Medication errors are common and often occur when patients move between healthcare settings. Around half of hospital medication errors occur on admission, transfer, and discharge. Of these medication errors, around 30% have the potential to cause harm to our patient. McLeod Regional Medical Center has implemented a unique way to decrease medication errors through a process called Med to Bed. This process includes the outpatient pharmacy being involved in the discharge process of patients. Patients now have the opportunity to have their prescriptions filled and delivered to their bedside prior to leaving the hospital. McLeod's Med to Bed process is an example of utilizing a hospital-based pharmacy.
Pharmacist Craig Habercorn has never worked at a place like this before. Instead of the community-based drugstores he's used to, Craig is filling prescriptions at a hospital-based pharmacy.
Everybody's been extremely positive. It's really been rewarding already just in the first few days.
It's a first for Lee Memorial Health System, too, something they hope will catch on with patients.
We want to make sure that when they're discharged, they have everything they need to go home and begin healing, as opposed to going home and needing to make several stops on the way home.
A lot of research went into stocking these shelves. These particular drugs are some of the most commonly prescribed in this hospital, along with some other hard-to-get medications.
We looked at the types of medications that patients were dispensed over the last year and made sure that we had all the very expensive and high-risk meds that people had trouble finding when they go home from the hospital, to make sure we had them in stock.
Lee Memorial is one of the 10 busiest hospitals in the country for joint replacements. Unlike your corner drugstore, pharmacists know when to brace for brisk business.
On the days that the surgeons see lots of patients, we know 2 days later we're going to have a lot of discharge patients that we need to care for.
It's all about better patient care.
Making sure that that patient is comfortable and the patient's family very comfortable knowing what the medication is, why they were prescribed it, what possible side effects they may encounter.
When it comes to a prescription, you don't have to leave for home without it.
Med to Bed is a program designed to help patients that are being discharged from the hospital have an easier time. Discharge prescriptions are filled here in our outpatient pharmacy and delivered back to the patient on the floor, so they don't have to stop on the way home to fill their prescriptions. One of the downfalls of the program is it sometimes delays the discharge of the patient from the hospital.
The purpose of this study is to analyze the Med to Bed process and evaluate its problems and successes. If we are able to identify where problems lie, we can make efforts to improve the process. The performance goals of our QI study include decreasing discharge time, increasing the number of patients that fill, and increasing patient satisfaction.
These goals are important to improve the quantity and quality of patients at McLeod Regional Medical Center. If we improve the process, we'll be able to make higher quality healthcare more accessible to the PD area. If we decrease the time of the process, we're making the medical team more available to other tasks and other patients. Increasing the number of patients helps the success of McLeod and the success of the patient's healthcare plan. We're striving for both a happy and healthy patient.
After analyzing data collected from September and October, we found that the average discharge time was about 91 minutes. This is the time from when the patient is confirmed to be discharged to when they are actually walking out of the door. The average amount of patients using the Med to Bed service was about 226 patients. We aim to improve this process by decreasing those times and increasing the amount of patients utilizing the service.
After analyzing the current approach, we have 4 potential solutions.
Our first solution is for the clinical team to prepare a list of medications that are commonly prescribed for each department. So this means each floor of the hospital will have their list of most frequently used medications for discharge. This will allow pharmacists and technicians to identify potential problems with cost or insurance before a patient is confirmed to discharge. The case manager can then take care of prior authorizations and change medications before prescriptions are written. Also, pharmacy can look up prices of medications that may be cheaper at other pharmacies. We can use GoodRx in advance, thus saving time at discharge.
Another potential solution would be to include the pharmacy team in the morning huddle so that they are aware of patients that may discharge and what potential medications they will go home on. This will allow the pharmacy to add the patient in the system beforehand and talk to the patient about the benefits of filling at our pharmacy. A third potential solution would be to get the nurses to discuss the program with the patients as they enter their home pharmacy in the EMR system. This will prevent the pharmacy from having to call and transfer electronic prescriptions. The final solution would be to compile a list of common insurances and their formularies. If we locate medications that are specific to each department on the formulary, it can be given to the physicians so they know what to prescribe and what not to prescribe.